Orofacial myofunctional disorders, DX, RX, TX, and PX. We created this so you can show not just yourself and your patients, but also your colleagues what you are looking for in your assessment. These are 32 clinical markers of the phenotypes of an orofacial myofunctional disorder. 20. Cavities and gum disease. Infectious diseases such as caries and periodontal diseases can compromise oral health. Colonizing bacteria form a complex community that adheres to tooth surfaces and forms a biofilm, commonly called plaque. Because ingredients in saliva contain components that can directly attack bacteria, if a patient is mouth-breathing or has a poor lip seal, the biofilms may become more virulent. After. Myofunctional therapists can promote nasal breathing, lip seal, eliminate tongue thrust and low tongue rest position, promote or stimulate chewing, promote proper swallowing, and the use of the tongue to clean the teeth and the oral cavity from food residue. Proper chewing and swallowing, along with proper diet and oral habit elimination, can be of aid to the management of oral health. Untreated. When the underlying causes of teeth and gum diseases are not addressed, tooth loss, periodontal disease, gum recession may prevail. According to current medical literature, periodontal disease is linked to systemic diseases. Patients may be more susceptible to cardiovascular disease, diabetes, digestive disorders, and other life-threatening problems. 21. Changes in saliva. Saliva has multiple purposes, and its enzymes provide the beginnings of the digestive system. Too little saliva affects chewing, swallowing, teeth and gum health, speech, sleep breathing, and digestion. Drooling may indicate too much saliva production, which is socially difficult to manage and causes facial skin rashes. Salivary output and quality depends on chewing, medication, stress, neurologic disorders, traumas, or mouth breathing. After. Changes in the quantity and quality of saliva may require medical interventions, depending on the cause of the change. However, myofunctional therapists are able to identify hyper or hyposalivation and address it in a multidisciplinary manner. Moreover, better chewing skills may be taught along with other strategies to optimize salivation. Untreated. Drooling in children is distressing for parents and caregivers. Chronic reduction of saliva, called xerostomia, or changes in its quality, impact teeth and gum health, digestion, and creates bad breath. Xerostomia also impacts sleep by reducing the surfactant properties of the oropharyngeal mucosa of the soft palate and pharynx. 22. Restricted maxilla, high palate. A normal palate should be shallow with a large arch, enough room to hold the tongue. When the tongue rests low habitually, or when there is a prolonged thumb-sucking habit and proper nasal breathing is absent, the force of the cheeks push the maxilla inward, changing the shape of the palate and the nasal cavities that share the palate, causing further nasal restrictions. After. Because the palate divides the oral from the nasal cavity, a high narrow palate could be a symptom or the cause of difficult nasal breathing, with other disorders linked to it: craniofacial disorders, TMD, malocclusion, muscle hypotonia, chewing and swallowing disorders, sleep disorders, and more. Untreated. Because the palate divides the oral cavity from the nasal cavity, a high narrow palate may be the symptom or the cause of reduced or absent nasal breathing, with all the disorders that are linked to it: craniofacial disorders, TMD, malocclusion, muscle hypotonia, chewing and swallowing disorders, sleep disorders, and more. When the tongue and orofacial muscles are not trained after palatal expansion, there may be a need for a permanent retainer, or one might experience orthodontic relapse and further malocclusion. Number 23, tongue scalloping. When the tongue constantly pushes against the teeth, especially in adults, the tongue develops indentations on the side. Scalloping is very common in people who have OSA or a restricted oral volume, as in certain malocclusions. After. During an oral examination, it's easy for a myofunctional therapist to identify the scalloping and to flag it to the referring physician, along with other probable signs or symptoms of sleep-disordered breathing. Untreated. Scalloping of the tongue per se is not a worrisome condition, but because it's caused by a chronic tongue thrust in adults, it suggests possible insufficient nasal breathing or sleep-disordered breathing or dental malocclusion as the trigger for the tongue thrust. Therefore, a multidisciplinary assessment and treatment of the underlying causes of the scalloping is needed. 24. Craniofacial dysfunction. Unlike genetic malformations such as a cleft palate or afacial dysmorphosis, the chronic impact of myofunctional disorders may cause change in the growth and development of the craniofacial complex, with malocclusions, restricted maxilla, small jaw, and changes in the head position and in orofacial functions, such as chewing, swallowing, and speech. After. Myofunctional therapy aims to prevent the formation of craniofacial dysfunctions by testing babies for tongue tie, assessing and restoring proper nasal breathing in the absence of allergies or obstructions, identifying signs of sleep disorders, stabilizing the mandible to support tongue function, and normalizing orofacial functions such as tongue and lips resting position, chewing, and swallowing. Untreated. There's a reciprocal influence of structures, bones, teeth, cartilage, and muscles, and functions, nasal breathing, swallowing, chewing. Poor functions influence the growth of the structures, which in turn may change or limit the functions themselves. The result is unfavorable growth and development of the face and mouth, often creating the need for maxillofacial surgery and extensive orthodontic treatments, or prolonged pain and discomfort. 25. Allergic shiners or venous pooling. Also called venous pooling is the darker area beneath the eyes, often present in persons with allergies, whom may also exhibit scratching, twitching, and wiping of the nose, allergic salute. After. Along with other signs and symptoms of allergies, myofunctional therapists can make the proper referral to ensure that patients are able to breathe comfortably through the nose. Also, therapists are trained to keep the patients motivated to stick with their hypoallergenic regimen. Untreated. Ignoring these signs makes the therapist miss some possible connections with allergies, which may significantly impact nasal breathing and therefore impact all the other orofacial functions and facial growth and development. 26. Eustachian tube dysfunction. The eustachian tubes connect the middle ear with the posterior portion of the nose. They provide aeration, air pressure balance, and drainage to the middle ear. Dysfunction of the opening may be due to allergies, atypical swallowing with tongue thrust, anatomical defects of the soft palate, or TMJ disorders. Also, a restricted maxilla may impact. After. The orthodontist will provide a palatal expansion and orthodontic treatment before retraining the tongue to be a natural retainer for the new palatal shape, while eliminating oral habits that could cause orthodontic relapse. Further referrals for an allergist and ENT may also be needed to address the causes of insufficient nasal breathing. Untreated. Eustachian tube dysfunction may lead to acute or chronic otitis media, earache, vestibular symptoms, delay in speech acquisition in young children, and comprehension difficulties. 27. Aesthetic changes. Misuse or disuse of the orofacial muscles and functions cause aesthetic problems, such as unpleasant open mouth posture, tongue thrust, facial grimaces, mannerisms, wrinkles and brows, which all may create self-image issues. After. Self-awareness for stress patterns, behavioral modification techniques, normalization of orofacial functions with chewing and swallowing, promotion of nasal breathing, elimination of parafunctions and habits, reduction of muscle pain are all techniques that myofunctional therapists use to help the patients achieve a more pleasant appearance. Untreated. Often unpleasant aesthetic changes are a symptom of dysfunctions more significant, and those are the ones that may be the problem. However, a healthy self-image is psychologically very important, and ignoring it may cause feelings of inadequacy. 28. Macroglossia. Macroglossia is the term given for the tongue when it appears too large for the oral cavity, and it may spill outside the occlusion of the teeth into the vestibular area between the lips and teeth. It's often seen in disorders of genetic origin, such as in Down syndrome. After. Myofunctional therapists will screen the tongue for restricted frenulum, repattern and activate all of the muscles of the tongue, and develop a palatal tongue rest position. The oral volume will also need to be increased with expansion of the palate and orthodontics, thus working with a multidisciplinary team. Untreated. If the tongue is not given proper room and retrained in proper unrestricted function, the patient will not be able to chew, breathe nasally, and swallow correctly, which may lead to digestive problems, sleep apnea, TMD, orthodontic, orthognathic surgery relapse, and self-image problems. 29. Abnormal breathing. The most important breathing abnormality is lack of proper, effortless, and quiet nasal breathing, as air transiting the nose receives many benefits which oral breathing does not provide. After the nasal cavities have been cleared by allergists and ENTs, the myofunctional therapist ensures that the habit, therefore the neuropsychological aspect of breathing, is addressed through techniques to promote lip seal and nasal breathing. Obstructive sleep apnea and snoring are also abnormal breathing patterns. Untreated. Reduced or lack of nasal breathing, especially during a child's development, is linked to unfavorable facial growth, orofacial muscle dysfunction, gum disease, a narrow maxilla, dental malocclusion, TMD, sleep disorders, postural changes of the neck and shoulders, and learning and cognitive problems. 30. Tinnitus. Perception of a noise in the ear, chronic or intermittent sounding like a whistle or rushing water or even a buzzing or hissing sound is what tinnitus describes. Tinnitus is more common in people with TMD and more bothersome in a quiet environment. After. Although tinnitus must be diagnosed by an ENT and assessed by an audiologist, given its multi-causal aspects, myofunctional therapy may be of assistance by normalizing orofacial functions and jaw stability, thus reducing or eliminating the symptom itself. Untreated. Although tinnitus per se is not damaging, the TMD, when that's the cause of it, is responsible for many other symptoms, of which tinnitus is just one of them. Infant feeding problems. Failure to latch on the breast, drooling, GERD, SIDS, sleep difficulties, tooth eruption problems, development of a high narrow palate, ADHD, breathing problems such as asthma and mouth breathings are all linked to infant feeding problems. After. Identify early and refer to a release if there's any restriction of the frenulum, either lingual or labial, and/or buckle, identify and refer mom to a lactation consultant and an osteopathic physician or other body worker, stimulate the tongue and promote its movement and promote range of motion of the jaw. If left untreated, the child may develop texture sensitivity issues and other digestive disorders, SIDS, posture problems, high narrow palate, malocclusion, speech problems, breathing disorders, self-regulation, and/or behavioral issues. Forward head posture. A forward head posture is when the head is not properly aligned on the neck and shoulders, but is positioned forward, changing the center of gravity of the head and then of the whole body. After, awareness of the head position is the first step. Neuropsychological and behavioral techniques are implemented to make the person aware of his or her posture at rest, during chewing, and swallowing. If left untreated, because the head is heavy, any degree of chronic positioning away from the center line of the body causes significant muscle strain to the head, neck, shoulders, and hips, and impinges on airways further. Over time, the strain causes pain, then physiologic changes, and then anatomical changes to bone, muscles, fascia, and connective tissues. Further information about this project and scientific references with a detailed bibliography, please visit us at www.aomtinfo.org/OMD Matrix.